Hello, my name is Dr. Keith Pearson. I'm Head of Medicines Management at Hayward, Middleton, Rochdale Clinical Commissioning Group, or CCG for short. Our organisation helps doctors to prescribe safely and effectively and advises them about the best course of action for patients who are receiving local treatments. Your doctor and pharmacist are ideally placed to offer you the best advice on medicines. However, we do know that some people have further questions about their medicines and would like further information. This short video tries to explain to you why your GP will not be able to prescribe all the medicines that you may actually need. If you have an uncommon condition such as blood pressure or type 2 diabetes, your GP will be able to prescribe very effectively for you. We have a wide range of medicines that are suitable for most people, and these are very effective in controlling your condition. If your GP feels that you need a more specialist opinion, he or she will refer you to a local, regional, or indeed a community-based specialist who may diagnose something which is slightly more unusual. In some circumstances, highly specialised treatment will be required. And in order to use this safely, certain times specialist monitoring will be required. This often involves blood tests or lung function tests or regular examinations with a specialist. Under these circumstances, your specialist might need to retain responsibility for prescribing your treatment. While this can be inconvenient for some, having to go back to the original doctor rather than your local GP, there's a very good reason for this, and I'll try in this short video to explain the reasons behind that. Across Greater Manchester, we take your safety as a patient very seriously, and the following measures are in place to help you receive the medicines you need in a safe and effective manner. Now, if you have to attend a specialist on a frequent basis, monthly or 3-monthly, we feel it's most appropriate that they assess you and also determine your ongoing need for certain specialist treatments. If the consultant is agreed that they are in the best position to prescribe your medicine, we need to do no more. They can often arrange to post a prescription to you, or if you have access to private transport, you can collect that from the hospital pharmacy. And in some cases, this causes no real problems. In order to give patients medication safely, we have given a great deal of thought to this across Greater Manchester and have categorised all medicines that people can use into either red, amber or green classifications. If we have classified a medicine you need as red, it means that it can only be prescribed by a specialist. This is because they have extra knowledge over and above that acquired by your GP in order to prescribe this medicine safely. We also have amber categorised medicines, whereby a consultant will initiate your treatment, then monitor you over a period of the next several months and ensure that your treatment is stable, you're tolerating it, and that any adverse effects that you have been marginalised by actually adjusting doses, or you tell the doctor that you're not having any particular problems. They may wish to undertake some blood monitoring or other monitoring to make sure that there are no side effects that we need to be concerned about. Lastly, we have green medicines. These are safe because we are very familiar with them. We're not aware of any major problems, and they don't require very frequent monitoring and can be safely prescribed by either hospital doctors or your own GP. So, some of the medicines which GPs are recommended they do not prescribe. These include anti-rejection drugs, for example, for people who've had kidney transplants or liver transplants. These can be very powerful drugs, and close monitoring is required to make sure that people aren't having any side effects and that their organs are not experiencing any damage as a result of the treatment. Patients who are undergoing cancer chemotherapy will be attending one of the regional specialist centres usually, and any medication they need will usually be provided before they leave the hospital and sufficient given before they have to return again for further treatment. In some cases, we do know that patients require very specialised medicines, and these can be given often as part of a clinical trial, whereby we don't fully understand all the benefits and side effects of the medicine, but we do know that in some patients they can be very helpful. We also know that some patients need medicines which are what we call off-label, such as these are licensed medicines, but they're used for unlicensed indication. We are all happy to use these where it's in the patient's best interest, but often we're required to monitor your treatment quite closely and undertake any necessary monitoring. Wherever possible, your GP will try to agree to prescribe AMBER classified medicines, as long as these are stable, you are experiencing no side effects, and you agree to ongoing monitoring. Your GP can generally only agree to take on this prescribing if the consultant supplies with what's called a shared care protocol. This is a very concise document which defines clinical responsibility both on behalf of the specialist and your GP. It also explains what actions may be required if an unusual blood test result comes up, or what actions your doctor has to take if you claim that you're experiencing major problems. In some case, this might involve stopping the medication, reducing the dose, or a rapid referral back to the specialist. We have across Greater Manchester agreed all drugs according to the red, amber and green classification. The reason why we've done this are several, and I'll try to explain the role of a group called the Greater Manchester Medicines Management Group, which some of you may have heard of. Certainly most GPs within Greater Manchester are aware of it, and we believe it's an excellent group in order to help you get the best from your medicines. If you have access to the internet, you can search Greater Manchester Medicines Management Group, or GMMMG for short. As part of that, you can see all the work we undertake, who's actually involved, and why we make the decisions that we do. So in summary, the Greater Manchester Medicines Management Group is there to advise all doctors, specialists, GPs, and some who are new to the area. And we're aware that some doctors come into Greater Manchester, work for several years, and therefore need advice about what our local decisions are. In Haywood, Middleton and Rochdale CCG, all our GP practices are familiar with the recommendations of the GMMMG group and rely on it on a daily basis to advise good prescribing for our patients. So who's in GMMMG? Well, people like myself, many GPs. We have several GPs from Haywood, Middleton, Rochdale who actually take part. Clinical specialists and excellence, those GPs who work in specialist areas. And altogether we have many, many years of expertise in medicines use. And we feel that we can really assess what the actual benefits of any medicines are, but also take a realistic view of the likely needs and overall costs of this if we need to do so. As part of this group, we have to make difficult decisions. So if we find, for example, that two drugs are equivalent in giving patients the best outcome, but one is half the price of another, for example, we would obviously recommend the cheapest drug as the first line. Now, this doesn't mean that it's less effective. It just means simply that this is best use of NHS resources. And as you may know, if we waste money on medicines when we can prescribe more cost-effective ones, that money is not available for other areas of care, such as referral to hospital or community services. As part of GMMMG, we have three main subgroups. One of them is called the interface group. As I've explained, all medicines are categorised in red, amber, green. The interface group defines the status of any current drug. This doesn't mean that you can't have it, it just means that it may need to come from a specialist if it's been categorised red, or started by a specialist if it's categorised amber. We also have a group called the New Therapies Group. This group looks at all new drugs coming to market. In some cases, these are novel, they're innovative, and they can offer real opportunities for patients who currently are undertreated or their treatment is causing them some problems. However, we have to be cautious when drugs arrive on the market that we have a limited knowledge about possible adverse effects. So we have to be, again, very careful that we don't push drugs too hard where we feel that further safety information is required. And therefore we might advise cautious approach from GPs in prescribing these drugs. We also have a formulary group, which looks at all drugs we currently use to find out if there are improvements which have been made or better drugs that need to be included and recommended to our local GPs. We also approve shared care protocols, which, as I've mentioned, are required before your GP can prescribe an amber categorised drugs. And over time, these will need to be reviewed and updated, and we undertake that function as well. The final, and arguably not the most important part of what we do, is we actually advocate a do not prescribe approach to some medicines to our GPs. Although all drugs have a license, many are questionable in terms of the overall benefits they provide to our patients. And therefore, although some people have a view that these are very effective, the actual clinical trial evidence would tell a different story. We do know that all medicines can have a placebo effect. And what we're trying to differentiate in any medicine is how much is a real benefit and how much is the drug actually related to its placebo effect. Whilst often it's very hard to try, what we do know that randomized controlled trials can help us get to the truth of the matter. At the end of the day, if we find out the medicines are there, but the clinical benefits they offer to our patients are very minimal, or in some cases highly questionable, what we do is issue a do not prescribe recommendation to our local GPs. There may be good reasons why GPs feel that they can prescribe or wish to prescribe this, and this will always be their clinical decision. But again, what we don't want to do is be wasting lots of scarce NHS resources on medicines with questionable effectiveness when we know that there are many medicines out there patients could get far better benefit from. So we feel that the benefit of having the Greater Manchester Medicines Management Group is that we can all share our expertise, our knowledge, our time in agreeing a set of medicines which offer the best opportunities for our patients, both in terms of patient safety, clinical effectiveness, and also cost. And if you're interested in this more, in this topic further, please Google Greater Manchester Medicines Management Group and have a look around. And if you have any further questions, please don't hesitate to ask your GP or community pharmacist who have got a lot of expertise in this area. Thank you.